everyone. This is Danielle Spetzer and Jackie Toulad from Concordia University, Wisconsin. We are presenting on the Nurse and Healthcare Worker Protection Act of 2015. This bill aims to reduce injuries to healthcare workers by establishing safe patient handling standards. As nurses, we work directly with patients, manually lifting them to assist, ambulate, and reposition. This manual lifting is strenuous on our bodies and is causing musculoskeletal injuries to healthcare workers every day. This is why we believe that this act is extremely important to get through legislation in order to protect all healthcare workers. Registered nurses and nursing assistants are some of the highest ranked professions for risk of suffering musculoskeletal injuries from patient lifting, transferring, and repositioning. 11,360 total cases of musculoskeletal injuries in registered nurses occurred in 2014, and 20,020 cases in nursing assistants. 52% of nurses complain of chronic back pain, and 38% have actually had to leave the profession as a result. Both nurses and patients are at risk from injury while being lifted, transferred, and repositioned without the use of mechanical assistance. Interventions to reduce musculoskeletal injuries among hospital staff has been studied, including education, back conditioning, and ergonomic practice implementation. Mechanical lifts decrease the amount of lifting, bending, and rotation needed to move patients, thus decreasing stress on the low back. A study in 2004 comparing rates of injury before and after implementing mechanical lifts showed a 37% decrease in musculoskeletal injuries after mechanical lifts were implemented. The study also showed an annual workers' compensation cost decrease from $484 per full-time employee to $151 per full-time employee after the mechanical lifts were implemented. 6 states, including Texas, Washington, Rhode Island, Maryland, Minnesota, and New Jersey, have laws in place that require hospitals to have safe patient handling programs and available lifting equipment. In summary, all healthcare employees should develop a safe patient handling and injury prevention program which uses technology, equipment, and accessories to reduce risk of injury to nurses and other healthcare workers. The intent of this act is to establish a federally mandated safe patient handling, mobility, and injury prevention standard for registered nurses and other healthcare professionals in order to protect their health and safety, addressing the nursing shortage and increasing patient safety.
Passing the Nurse and Healthcare Worker Protection Act of 2015 is crucial. Healthcare workers are the most prone to musculoskeletal injuries. The purpose of this bill is to implement safe patient handling and mobility so that we can eradicate injuries due to manual lifting. Work-related injuries result in employers having to pay for not only workmen's compensation, but the nurses that have to replace this staff until they are able to work again, if they are able to work again. Passing this bill would allow employers to preserve budget and staff. By doing that, employers will increase staff satisfaction. Work injuries are expensive. Unsafe patient handling and mobility cost more than $7 billion in workmen's compensation, medical bills, and replacing staff. According to the American Nurses Association, hospitals that involve safe patient handling and mobility can save between $27,000 and $103,000 per nurse. Passing this bill through legislation would save a lot of money for hospitals. An important stakeholder in this bill would be the American Nurses Association. The American Nurses Association strongly urges nurses to support this bill. Other essential stakeholders would be the Occupational Safety and Health Administration, popularly known as OSHA, and the National Institute for Occupational Safety and Health. OSHA's mission is to ensure safe working conditions for employees. The National Institute for Occupational Safety and Health's vision is to have safe and healthier employees. One of the National Institute for Occupational Safety and Health's goals for 2016 to 2020 is to reduce work injury and improve well-being. Other stakeholders would include healthcare facilities, state nursing associations, and most importantly, nurses and nursing assistants. As nurses that have to lift, assist, and reposition patients daily, we firmly believe that a safe patient handling and injury prevention program should take action in all healthcare facilities. The Nurse and Healthcare Worker Protection Act of 2015 must be passed through legislation and not be put on the back burner anymore. Healthcare workers should not have to hurt themselves at work. It does not make any sense for us to help people to get better while we become injured. All healthcare facilities should invest in the proper lifting equipment. Although it will initially be costly to purchase lifting equipment, it would benefit the facility and healthcare workers in the long run. We would like to thank you for your time and for listening to our presentation. We hope you consider the importance of safe patient handling and mobility and see how it can improve healthcare and nursing satisfaction.